Mental health is set to receive record funding in tonight's budget. A new digital platform is expected to be the centrepiece of the plan to provide better access to information and support. Joining me live now is the Black Dog Institute Deputy Director, Samuel Harvey. Samuel Harvey, thanks for your time. What do you need to see in the budget tonight?
Well, like lots of sectors, we're crossing our fingers and hoping that the mental health sector gets what it's needed for many years, which is a proper overhaul and some proper funding. Australia missed some of the worst health consequences of COVID, but we certainly didn't miss the mental health consequences of COVID. We and other mental health providers have seen a real surge in demand, and it's put incredible strain on a system that was already struggling. We've got a fragmented system, we've got an underfunded system. What we're desperately hoping to see is that the government is able to take on board the recommendations from the Productivity Commission and the Royal Commission into Mental Health and put some of the investment in that the system needs.
Indeed, and you mentioned the word then, it's productivity. So this is about not just the well-being of our fellow citizens, but about being more productive in the economy, isn't it?
Oh, absolutely, and I think that's really the take-home message from all of those big inquiries, is that yes, the mental health system needs a lot of money to make it fit for purpose. The Productivity Commission estimated that just for their Tier 1 recommendations, it would be over $2 billion. But the good news is that the economic benefits from that investment will more than cover those costs. And I think that's an important thing to remember. It's not psychiatrists like me making this argument. These are economists who have looked at the return on investment from getting our mental health system right and say unequivocally that this is an investment that will pay for itself by getting people back to work, getting people back into their productive lives that they should be able to enjoy.
Yes, they should indeed. I mean, look, the statistics are frightening when it comes to suicide in this country, and anxiety disorders extend well beyond that as well. It's not just money that's needed here. Do you think there has been a shift in understanding of mental health issues in the last year in particular?
I think there has. I mean, I think in the last year it's continued that pattern we've seen where we've got more comfortable talking about mental health. And I think, what was really noticeable during COVID from very early on, policymakers and the general public were happy to talk about what the mental health impacts of this was going to be. While that's good, I think there is a problem that for a number of years Australia has really led the world in talking about mental health. I think for us in the sector, our feeling is it's now time to get beyond talking and really look into action. And there's something particularly problematic about us saying to people, let's talk about mental health. If you need help, put your hand up, let's get help. But then not making sure there's the systems that are there to help people when they do put their hand up. So that's really where we're pushing now, is saying it's great we've made these changes. It's great that people are able to talk about mental health. Let's make sure people can access help when they need it.
Indeed. Well, we hope to see those figures and also that support when we read the budget later tonight, and we all get the detail at around 7:30. Thanks so much for your time.
Thank you.